Okay, so I was going to go into detail of the functions of bone, the structural function and the metabolic functions, and the normal structure primarily is lamellar and woven types of two different kinds of bones that we have. And the composition of bone is primarily matrix and the cells. The matrix is 40% organic, which includes type 1 collagen, proteoglycans, osteocalcin, osteonectin, growth factors, cytokines, osteoid, and 60% is inorganic, which is calcium hydroxyapatite. And the cells within the bone are the osteoclasts, osteoblasts, osteocytes, and progenitor cells. Hang on, what have I done here? Thank you. So if you look at this picture, primarily it just shows you a normal structure of the bone, where in the middle you can see is the adipocyte, and on the edges you have the osteoblast surrounded by the osteoid and the osteocyte deep buried within the bone. Now, vitamin D or cholecalciferol is important for the functioning of the bone, and it's a very complicated slide, and downloaded from Michael Hollick's landmark article of the New England Journal of 2007. And primarily there is, if I can just very quickly, there is the effect of sunlight which converts 7-dehydrocholecalciferol to calciferol, and then there is metabolism in the liver and kidney, and then the target organs, which is the calcium absorption through the intestines, the effect on the parathyroid glands, a negative effect on the parathyroid glands, the secretion of parathyroid hormone, and within there are calcium receptors or receptors for vitamin D present in every cell of the body. So the active metabolite, which is the 125, has got receptors in every cell of the body. And why this is important, I'll come to that in a minute. But primarily, just to simplify, so vitamin D is converted to 25-hydroxyvitamin D in the liver, and then the active form in the kidney, and the inactive form, which is again metabolized within the kidney, the 24-25 calcitroic acid. There are several terms which are used to describe vitamin D, and I get very confused, and I thought I'd just share the confusion with you. There's a term called vitamin D1, which is ergocalciferol with lumetrol, not available. But vitamin D2 is ergocalciferol, which is naturally produced by plants, fungus, and invertebrates. And it has some, it is assumed that it has a protective effect of the ultraviolet radiation against DNA damage in these organisms. Whereas the vitamin D3, which is produced in the humans, in the skin. Now, calciferol is the term, unified term used for vitamin D2 and D3, and usually what we get within supplements are sometimes it is vitamin D or sometimes it is vitamin D3. Calcidiol is a term used for the liver metabolite, and calcitriol for the active hormone. Osteomalacia is primarily defined as failure of bone mineralization, increased bone turnover, and so on. And I will skip over these slides and just show you two bone biopsy slides. The one on your left in blue shows that in the blue line is the widened osteoid, and it is not surrounded by the mineralized bone. And the other slide, which is a tetracycline labeled slide, shows you the widened osteoid in the orange. And if there was some mineralization, it has been surrounded by a yellow line of mineralization. If the patient had, it is a low turnover vitamin D state, nutrition deficiency. So if you have the access to these kind of sophisticated stains and machines is not easily available, and one is by and large relying on a serum test and the clinical features. And what is the definition of vitamin D deficiency? By and large, it is less than 20 nanograms, that's deficiency. Between 20 to 30 nanograms, that is insufficiency, and not enough. Beyond 30, you are in the normal range, and the physiological functions start getting better. Now, if you take this definition, then around 1 billion people in the world have vitamin D deficiency or insufficiency. That's a huge burden. Why this is important, and I'll come to that in my coming slides. If you look into the data published by Lipson et al. In 2006, they reported that 50% of women on medication for osteoporosis had vitamin D deficiency, although they were taking some supplements in the form of calcium and vitamin D, but that was not enough. I went through and did some search if I could come up with some data within the country in Pakistan. And the oldest I got was this study from Civil Hospital, Karachi, in which they reported 200 women. Of these, 52 were multipara, more than 5 children, and 128 unmarried girls. And the symptoms, the commonest symptoms they reported were waddling gait and generalized body pain. And they reported a low serum calcium, raised PTH, and low phosphorus in these numbers. And loser zone was perhaps the index of suspicion in which they were picked up and then investigated. Now, another study coming from the north, that is in Kohastani women, same year, 2004, from a youth medical college, and there they looked at the 50 women. They were all 23 years age, and their symptoms more or less were of bone tenderness and a waddling gait. And 12% of them were pregnant, and I'll just switch my mobile off, it's interfering with the presentation. There we go. Okay, so they had small numbers, but at least they presented again very symptomatic patients, 50 patients. Another study reported in 2006 from the Aga Khan University Hospital, they looked at the bone biopsy figures. And these were the patients who were admitted with fractures neck or femur, and they took off a portion of the bone and sent it to lab for histopathology. And of these, in this group, they had 168 patients with a median age of 61 years. And 13 of these had bone biopsy features of osteomalacia. However, they